A 4-year construction project to remodel, renovate, and expand the Wyoming Life Resource Center in Lander is complete, but the process to repurpose the mission of the center took longer than that. I'm Steve Peck of WyomingPBS. We're at the Wyoming Life Resource Center, and this is Wyoming Chronicle.
Funding for this program is made possible in part by the Wyoming Humanities Council, helping Wyoming take a closer look at life through the humanities, thinkwhy.org, and by the members of the Wyoming PBS Foundation. Thank you for your support.
Rarely has any public works project in Wyoming commanded the time, effort, and expense of the redefinition, renovation, and expansion of the Wyoming Life Resource Center in Lander and its sister facility, the Wyoming State Hospital in Evanston. In Lander, the Life Resource Center was dedicated late last year, and now, with full occupancy and operating under its new mission guidelines, 4 critical participants in the new and much improved facility tell its story.
This campus that you're sitting on right now first opened in 1912, so it's over 100 years old.
Stephen Johansson is the director of the Wyoming Department of Health.
Going back to 2012 and 2013, the Department of Health realized that across many of our facilities here, our state hospital in Evanston and others, we were in some significant need of capital improvements, capital construction.
Through a decade of legislative service, State Representative Lloyd Larson of Lander was immersed in the Life Resource Center project from start to finish.
At the conclusion of 2013, which was my first year, so that's 10 years ago, I was serving on the Labor and Health Committee, and we had received a report on the conditions of our state facilities, including the state hospital, this facility, the retirement center, and the veterans facility in Buffalo. And we reviewed that report, and it had identified that there were some concerns on the assets, the buildings in each of these facilities, and specifically at the state hospital and here at the Life Resource Center, that the conditions of the building perhaps weren't conducive to the populations being served.
The group that started that process didn't just look at the construction needs. We really rethought and remissioned both the state hospital and the Life Resource Center to really accommodate the needs that Wyoming is seeing with folks who are really the most vulnerable in terms of behavioral health around the state. And that kicked off a process to truly answer what's the role of state government in caring for these vulnerable folks.
The recommendation back was that we probably need to consider re-evaluating the mission of these facilities.
So historically, the mission of the state hospital, which is in Evanston, what was then called the Wyoming State Training School in Lander, were quite different. What were those in previous generations?
State Hospital has always been the state's only state-owned, psychiatric hospital, but it's evolved as well. And over the, I think at its peak, we had 700 patients at the state hospital. And in the 60s and 70s, both in Wyoming and nationally, there was a big movement to deinstitutionalize and serve folks in more appropriate settings in the communities. And we're proud that that has happened, and the Department of Health has a big role in that. But part of the remissioning of these 2 facilities in Evanston and Lander has been to really narrowly focus the state hospital as an acute psychiatric facility to provide folks who are in behavioral health crisis the services they need on a short-term basis so that we can discharge them to more appropriate and less restrictive settings.
Jeremy Forbes is the on-site administrator of the Life Resource Center in Lander.
Over the course of the 110-year life of WLRC, we've went from a long-term custodial care model for folks with intellectual disabilities to a new model as of 2016 that really looked at, okay, the private community can and should be providing services to the majority of folks with intellectual disabilities in our communities. However, for the folks who manifest exceptionally difficult behaviors, there seemed to be a gap in that service. So that's where we came in with the new mission and the new buildings to be able to bring folks in through assessment, provide targeted treatment on whatever is keeping them from being safe in the community, and providing that service and getting them back out to the community as soon as possible.
But getting those people that really had mental health issues and not endangerment to themselves or other issues into a facility such as the Life Resource Center, expanding that mission to include taking care of people that maybe have come out of nursing homes or out of their own homes that had some challenges that needed some correction, as well as this legacy population that has been served here in Lander for those with developmental disabilities and intellectual disabilities since the early 1900s, and as well for those who had had acquired brain injuries.
So the model actually looks at short and intermediate care. Some individuals could be here for a long time, but really the treatment and the time in which they're going to be here is completely dependent upon their service needs and how we can provide them.
In the past, it's fair to say that for a lot of the residents, this facility, it was sort of an out of sight, out of mind
Right.
model. You're here and you're going to stay here. And what began to change that led to this mission refocus, do you think?
I mean, from my perspective, some of those early deinstitutional efforts really started that process change. Similar to this Wyoming State Hospital, the Wyoming Life Resource Center had as many as 700 individuals in the 1980s. So we saw a steep decline in the number of folks that we served. And so that just kind of led us to this new mission, which is to be complementary to the community programs, not to compete, but to be an asset to them to be able to provide intensive resources that they may not have, and then quickly get those individuals back out in the community as soon as they are ready.
To say what is the role of the state then for providing services to them would be as a safety net. If the community or if a home can't accomplish that, then the state has a responsibility to help them have as productive of a life as they possibly can have.
We talk a lot when we're discussing facility-based versus community-based care with these types of populations. And it's important for me to note that other states, when you talk about intermediate care facilities or what we call ICFs, facility-based care for folks with intellectual disabilities, you see a lot of states and a lot of other parts of the country just scaling back, closing those types of facilities. And something that was so important that I really have to give credit to our legislative partners, the Facilities Task Force from back several years ago. It wasn't just let's look at closing down a facility and propping up the state hospital or vice versa. It was really rethinking that mission of how does the Life Resource Center, how does this campus really fit into that new continuum of care that does put so much importance on community integration and less restrictive settings.
If they're going to have a productive life with the intent that it would be short-term, being able to come here, get stabilized, and then move into a less restrictive environment, what should these facilities look like? Which is then when we created a work group, which consisted of Department of Health members and legislative members. We spent time looking around, made trips to Montana, to Oregon, looked at facilities, asked them how they do it.
That's a huge innovation for that Wyoming has gone through, to not just think about construction, think about building or bulldozing physical assets, but really how does the state fit? What's the role of the state in our physical footprint, in our facilities, to be integrated into that sort of evolved continuum that we've seen nationally?
Does the fact that Wyoming is the least populated state in the nation play into that at all? Am I right in guessing that, or suspecting there might not be the community role that's even possible to play in our small cities, small towns, small state?
I think, Steve, it's a good question, and I'm very proud of Wyoming with a huge geography and a small population. for being able to provide the types of services in the communities that we do for folks with mental illness and developmental disabilities. We actually have one of the highest densities per capita of community developmental disability providers in the country, which is fantastic. And I think, again, reiterating what I mentioned before, part of what the groups, the legislature, executive branch that conceived of this new mission, where they really hit the nail on the head, is integrating these two facilities in Evanston and Lander into that broader service delivery for folks, not only with mental illness, but also developmental disabilities, and sometimes both, where these two safety net facilities can really be a part of that continuum, but also connect to them both on the front end and the back end.
We really found that what we had conceived in our mind really warranted some adjusting, really allowed us to come to this greenhouse model here in Lander, to where we treat it as a home. So as an individual comes here, they'll have their room, they'll have their space. It won't be shared. And that's really an important component of this, to make it as least restrictive as possible.
You look around the cottage that we're sitting in, and there's so many others on this campus. These were intentionally designed, and it's innovative for Wyoming to have the first intermediate care facility / skilled nursing facility that was designed based on the greenhouse concept. The greenhouse concept of care is really a home-like environment, and you can see that in the building that we're in now. The rooms are private, there's communal areas. It really does feel like someone's home. And we have similar design at the state hospital, albeit a different setting. It's an acute hospital setting. But the task force, the construction work group, everybody who designed these facilities really took great strides to make sure that we know folks that come to these facilities are in tough times. They're in crisis, they have significant needs. And designing these facilities to be so much less institutional and so much more as a home, we've already seen great success in the clients that have been served here in just how much that contributes to their overall treatment, their recovery, and their ability to discharge to lower levels of care.
Then when we got to the design phase and we had selected an architect to look at this, we come to the campus of the Life Resource Center and at Evanston over the course of a year several times, and met with the staff and said, so direct service providers, when you're in a room working with a client, what do you need? And prior to this, you would find that there's a lot of lifting and a lot of moving of people who don't always have the ability to help you in that process. It's a real strain, and in small rooms doesn't help that. And so the staff of both these facilities really helped design what we have today.
So it's going from not just the conceptual part of it, but you're getting right down to some pretty nuts and bolts things here. Yeah, we want to be able to provide this kind of an atmosphere, okay. We need a wider doorway sometimes to do that. Bob Nicholas is a state legislator from Cheyenne, but he grew up in Lander. As co-chairman of the Joint Appropriations Committee, he knows Wyoming's fiscal picture better than almost anyone, a key element in planning the Life Resource Center project and paying for it. You're known in the legislature as one of the money men as well. It must have been immediately clear that this was going to be an expensive proposition.
Yeah, $85 million, basically.
And that's got to be one of the biggest, is it the biggest public works project ever attempted in this community? I would imagine. It has to be one of them.
In this community, absolutely, yeah.
So I'm assuming the easiest part of it would be to come onto the old campus and say, boy, that building is crumbling, it's old, for whatever purpose it's being used, it's time to replace it. But then what you're learning in addition, and the part of your own lengthy re-education on these issues just makes it all the more interesting, of course, but complicated.
I would say it was extremely complicated, and the good news is that to me this project is a demonstration of the good that the legislature can do and our executive branch to make the world a better place and fulfill the basic functions of government that we're supposed to do as legislators. And it gives us the opportunity to be part of the community, and to do good things, and so everyone is a better individual, we're a better community, and we're a better state.
And when people ask, how can you spend so much money on something? Sometimes the answer is because it's important.
Yeah, exactly.
And that's what you found.
And that's what our function is. Mm-hmm. It's just an amazing process. And working with Stefan and Jeremy and with the staff here, and regularly updating the legislature and giving them tours when they're and as this thing progresses. It's going to be sad when it's over. It's just because it's been a wonderful learning experience and a relationship building for everybody.
When you're thinking about finding the money for something this big, was there an account set aside that we're going to place money here for the time being?
So you go through a process and determine what you think the cost is going to be, right? And then you start appropriating for it. And we have a strategic investment projects account. We call it SIPA, where we take some of the revenue generated off the Permanent Mineral Trust Fund revenue, and we start saving for these specific projects. And that's really how we funded both of these. And when we sat down with the architects, when we got to the point that we're going to do design and build, we was in Cheyenne at the old Jonah building, and they said, so what is the intent for financing the construction of these two buildings? And I remember Representative Nicholas says, we'll pay in cash. And they were just dumbfounded. They says, you mean there won't be a bond? There won't be, and he says, no. It'll be paid for, and that's what we do in Wyoming. We get the cash, save for it, and put it aside. And the initial estimate was going to be $140 million for the two projects, 70 million a piece, and we run into some contaminants here that push that up here.
Of course, you want to do it cost effectively. You don't want to waste money. But I've heard other people say, well, the question is whether to do it cheap or do it right. Does that enter into the legislative process? Was it a hard sell in some cases to make these decisions or get other people to agree to them?
It really wasn't a hard sell. What we had done our homework. We had the architects and design and the estimated costs, and we said, look, if we're going to do this, this is the way to do it. Otherwise, we won't do anything. Well, and it's as you said, well, let's do it right if we're going to do it. And, right at that period of time, there was some excess cash, and literally we just went out and grabbed every bucket we could, and as part of the SIPA came up, so we knew we had the funds to get it, to move forward with it. And I would say that once we explained it and presented it, we had overwhelming support from the legislature.
In addition to different types of residents, there's a lot of different types of work that go on under the same roof. What are some of the jobs that people have working here?
It's a great question. So the days of crushing cans, shredding paper, those days are behind us. So what we try to do is tailor any job or work program to both the needs and the preferences of the individual. So we have a new horticultural building that we've opened up. Actually, we've remodeled it and brought it back to life. So some of our employees and residents work over there, and they grow produce, they grow flowers, they grow things like that. There's a lot of jobs that we're working on. COVID kind of set us back a little bit. We intended to do a lot of community-based work as well. So that's kind of back on the decision block here as we move forward. So we've had to kind of regroup a little bit, do a lot of things on campus, but whatever our individuals want to do, we try to accommodate it. So if they're interested in working in the skilled labor side or janitorial or over in the auto body shop, we do everything we can to look at and do assessments to say, number one, are they going to be safe? And two, how can we make this happen? And then we start small and we grow it. So some of our individuals work 6, sometimes 8 hours a day. Others work 15 minutes a day. It really depends on where they are in their treatment and what their needs are. Through medication adjustment, through better behavioral support plans that manage their environment. Once we get them to the point where, they're doing really well and they have a couple of months of real stability, then we start looking for discharge, and that's where we reach out and start working with the guardian and our home-based community service providers and really find that next spot. Discharge planning starts the day that they arrive. That is our goal, and that's what we work towards.
It's an important economic element to the community,
Right.
As well, and that's important to be said and to be understood.
Absolutely. I mean, we provide up to 370 positions up here with full state benefits. It is a major economic driver for this county.
So we're talking about education, we're talking about treatment, we're talking about healthcare, we're talking about, of course, it's a big facility, we're talking about maintenance. What other, am I missing some things there? Administration, of course.
Yeah, well, and let's talk about the important people here, which are universal healthcare workers, CNAs, direct care professionals. So what we're trying to do is promote the folks who work the closest with the individuals we serve. Those are the most important jobs up here. So people like myself, our whole job is to provide them with the resources and the empowerment to be happy in their jobs and to be able to fulfill their missions.
I would think a big part of this through the years has been educating the public, preparing the public, the general public, for the changes in the residential status of the residents here. Are you finding that through the years that the state is becoming more receptive to this whole concept?
I think so, Steve, and I'll mention that it's nice to see the support that this facility has, both here locally in Lander, but also in Fremont County more broadly, and the state writ large. It has been a building process and a culture change to implement the new mission here. Both here on the campus and obviously with the kind of changes we've seen, a lot of concerns over the years. How are we going to be able to get this done? Are we going to be able to serve the type of clientele that we're being missioned for? And to your point earlier, can we staff these facilities? I am nothing but optimistic about our ability to nail these new missions. We have challenges ahead of us, especially on the staffing side, but the support that we've seen both locally here in Lander, but also from the staff over the years to really buy into this new idea. And it's worth noting that the service in this new facility doesn't start today when we open. We have been gradually implementing this model, as Jeremy mentioned, since 2016, and we've seen some really great successes.
Let's talk about what happened here physically as well. What happened physically that we could compare today to what the campus was 10 years ago? Yeah,
basically, from a very stark perspective, we moved in and demolished the whole internal part of the campus. So there was, around 17 or so buildings that needed to go as part of our demolition to make the way for this new greenhouse model of care. And then we've added around 15 new buildings, 10 of which are residential buildings. Each of those buildings is approximately 10,000 square feet of healthcare space. That includes, again, private bathrooms, private bedrooms. It's been quite an undertaking.
We're sitting in one of those now, correct?
We are. We're sitting right now in our ICF, which is our intermediate care facility building for the exceptionally difficult behavior wing, if you will. So it's a little bit, higher built than what you'd see in the community in terms of the physical structure itself. It's a very robust building.
The facility has gone through a lot just on the construction side. It's important to remember during the last 2 or 3 years of getting all this site work done, the facility kept operating. Under a massive construction project, a lot of logistical changes, and they deserve a lot of credit for continuing to serve the residents we have here and bring on new residents during this time period.
Some residents of the Wyoming Life Resource Center have been here for a long time, and they predate this type of planning. Will there be a different model for their residency here going forward? Is that part of the plan?
That was really important that we established a policy for that early on and say that this population that was here at the time we changed the statutes to make it a safety net, know that this is their home for as long as they need it. And they could leave if they and their guardian so chose, but they would not be forced to leave. They really are an important part of the community.
The campus here is big. How many acres is it? Or
So we are on about 100 acres right here with a lot of state land behind us.
and it's old. It has what we call mature landscaping. It's a beautiful part of Lander. And you wanted to preserve that aspect of it as well. I mean, the easiest thing in the world to do, I would think, would be to go another half mile further out of town and level off a piece of ground and put a square building there and start providing the service. But that was not part of this plan ever. The part of the plan was to preserve what has been here for 100 years.
Yeah, that's correct. And so if you look at our campus, it's a big, beautiful green space with mature trees that are, up to 100 years old. And, we did remove some of that as part of this building process, but have backfilled with a bunch of new various trees. And really, we tried everything possible to keep all of our existing trees on campus through this process.
Every interview I've done this year has had the COVID question in it. How did it affect you here?
It's been a challenge, both at this project and at the state hospital, to get to completion, given the challenges that brought. I can't commend Jeremy and his staff enough for working as a healthcare facility with some of the most vulnerable residents that we have in this state, vulnerable to infectious disease, not just COVID, but others. It was a trying and a tough time, and there were a lot of changes. But if there's one thing we've learned over the years, whether it's this disruption with this big construction projects or COVID, our staff and our state can get through those things.
Part of being a legislator in Wyoming, where there's part-time legislators coming from all different walks of life, you need to become experts in different things, at least for a short period of time, to get things done. That's got to be a very stimulating part of the job, I would assume.
Yes, it is, and to learn about, psychiatric facilities. But we really were fortunate to have a good group of people to work with. Our current director for the Department of Family Services, Corin Schmidt, was the deputy director for the Department of Health, was head of the working group before Director Joe Hansen was. And her and Bob spent a millennial of hours forcing us to look at brick.
To look at brick.
To look at brick. We looked at more brick than you can imagine, because they wanted this to be something that 100 years from now, people would say they took their time and it looks nice.
I look around this room, I look at the color coordinations of the furniture. We picked it all. I'm going, I hope we did a good job. You always have second thoughts or what we could do better, but it's a beautiful campus.
I'm assuming you both must be proud of what's happened here.
We've established relationships with the staff and leadership, and we're proud of what we did and really excited to launch this thing.
It's a thrilling event to see this being completed, because it's representative of what Wyoming is.
What they've invested in, what we've invested in as a state, this is going to be multiple generational return on investment. And this is a legacy type project where we're going to see 50, 75, 100 years of benefit for the state in serving the folks most in need in a much better way.
That we're concerned about this population of people and the citizens. And I don't know that people fully understand that when they look at the legislature, look at the state. The desire to really move Wyoming forward into the future in a way that provides the best life that you could have anywhere in the United States, and that includes this population as well.